families, educators, mentors, friends, and future healthcare leaders. We thank you for taking the time out of your busy schedules to attend this event. Of all the forms of inequality, injustice in health is the most shocking and the most inhumane. This is Martin Luther King Jr., quoted by Harriet A. Washington in Medical Apartheid, which many of you might recognize as our first assigned reading in medical school. So from our first day on campus, our school ingrained in us a responsibility as future leaders in medicine to recognize how healthcare institutions harm marginalized patients and how we have a responsibility to counteract these inequities on a global scale. Israel's military campaign in Gaza has directly targeted and devastated healthcare infrastructure. The scale of the devastation is unprecedented and resulted in the invocation of Article 99 by the UN Secretary General for the first time in over 50 years. From his statement, the healthcare system in Gaza is collapsing. Hospitals have turned into battlegrounds. Tonight, we have gathered a panel of educators who will recount the destruction of healthcare infrastructure and its effects on providers, patients, and Palestinian society as a whole. We will then have a brief question and answer session for all of our speakers. Prior to medical school, Ghassan completed a master's degree in global and public health at UCL, where he conducted extensive research on the public health infrastructure in the Middle East, adolescent and refugee mental health, as well as the sociocultural and socioeconomic factors related to refugee health in Lebanon. During medical school, he was director of his institution's Asylum clinic and conducted many community-based interventions for the undocumented community, as well as research related to immigrant health. He is interested in community and public psychiatry, integrated psychotherapy, refugee health, healthcare delivery networks, and narrative medicine. Please join me in welcoming Dr. Nick.
Hello everyone. Lovely to be here, and thank you so much to the organizers. So as of now, the figures as we've gone through, there are 18,000 reported deaths according to some reports. Some reports from the Palestinian Ministry of Health are as high as over 20,000, with over 8,000 children killed, over 1.8 million displaced, and as we heard, 52,000 housing units destroyed. We have some reports stating that nearly 90% of Gaza's population has been displaced, which has been a common theme when it comes to the Middle East and North Africa, and we'll get into the health consequences of displacement later on. Nearly 300 healthcare workers have been killed, 42 have currently been abducted, crossing from different parts of Gaza or have been abducted straight from the hospital itself, with no contact to their families or their associated staff. 135 healthcare facilities have been targeted, and only a few days ago, the largest medical school at the Islamic University of Gaza was bombed and completely destroyed, which will have lasting effects in creating, a workforce for the future. 128 were killed, individuals were killed in the West Bank and East Jerusalem, both by occupying forces and settlers, and 82 journalists have been targeted and killed. And in some cases, the family members of very well-known journalists, such as Wael Dahdour, were targeted while he was out covering the news in Gaza. And there are varying figures for the amount of people that are currently buried under the rubble. And as Dr. Makdashi had said, that people are digging them out with their bare hands and are also falling victim to violence, as well as, the falling of buildings on these heroic people that are risking everything to dig people out. So the pre-existing barriers, both in Palestine, both in the West Bank and in Gaza, include shortage of supplies, shortage of medicines, and interrupted supplies of medicines, very severely small, restricted capacity for intensive care, especially now, which is incredibly important. restricted opportunities for training both in Palestine as well as abroad, and then shortage of rehabilitation services for people that live with these long-term injuries or have been injured from past offenses. Additionally, we have overcrowding, which is a huge problem both in Gaza and in the West Bank. As we had discussed, shortage of medicines, which can prove incredibly deadly in certain scenarios when patients are facing emergencies such as, you know, MIs or strokes. There's a huge lack of experts in specialties such as vascular surgery, neurosurgery, trauma surgery, really all sorts of surgery, emergency medicine, and renal medicine. The only one of two or three renal medical doctors in Gaza was actually killed just a few weeks ago. And, you have a lack of medical instruments and equipment, that is especially augmented by the current offensive in Gaza. And, a lack of medical imaging machines. Prior to this, there was no CT PET scanners available in Gaza at all. So people had to go outside for that, which I'll get into. So before getting into it, just a quick contextual basis of the Palestinian healthcare system. You have a mix of the Ministry of Health that was established post-Oslo. You have a fractured system overall, though, that relies on NGOs, some of which have existed prior to Oslo, actually many of which. The UNRWA, which is the UN Agency for Palestinian Refugees, private sector suppliers, and the Ministry of Health, which operates both in the West Bank and in Gaza according to their separate governments, the PA and Hamas. And many NGOs existed before the Ministry of Health, and they operate hospitals, primary health clinics, and mobile clinics. But this sort of fragmentation not only is a testament to the lack of sovereignty or the ability to plan and control the overall healthcare system within Palestine, it also does create complications when it comes to management of patients, when it comes to continued care of patients. And it is, in many ways, dependent on aid. So prior to this offensive and prior to the destruction of hospitals, you had 13 government hospitals, 50, quite a few primary healthcare centers, 50 of which were run by the Ministry of Health, 22 UNRWA, and 70 NGOs. All of these are subject to bombing and destruction, especially since October 7th. 40 private hospitals, some of which come from donors, such as the Indonesian hospital, 2 medical schools and a nursing school that teaches 5,000 nursing students, and less than 20 psychiatrists in Gaza. So you're already dealing with a strapped and really restricted healthcare system there. So prior to Oslo, the healthcare system was entirely within the control of the occupying power. There was historic disinvestment in this healthcare system, restricted involvement of Palestinians in leadership positions as well as in physician positions, restrictions on medications being imported into those particular healthcare facilities. That obviously continues onwards till today because of the control of the borders and the import and export into Gaza and the West Bank. And then the threats on education and brain drain is actually a huge global health issue. Many highly skilled laborers in a lot of the global South end up leaving for, creating a more sustainable life abroad and to support their families. So an already strapped labor force is even made more strapped really because of that. And the deprivation of funding for decades and decades leading up to Oslo should not be discounted, because that already created a shaky foundation that prevented a sustainable, independent Palestinian healthcare system. And obviously, we can talk about the frequent attacks on healthcare infrastructure. That's nothing new. It's just really been exaggerated within the last 2 months. I wish I could go through this story. This is actually an account of a Palestinian living within the Green Lines, training within an Israeli hospital system. I can share these later, but he really does. Dr. Tannous has published this before and really has some great stories. So the permit regime, I want to start there. So Palestinians must apply for permits for medical treatment that they cannot receive within the occupied territories. So they mainly will go to Israel, Jordan, and Egypt, but even PSCRF will facilitate some cases, specifically usually pediatric cases, to come to the US. So in 2017, 54% of the permits were approved. That means 46% of people that required higher levels of care were restricted that access to care, oftentimes for no reason, not given any reason whatsoever. And in many cases, people do receive a rejection prior to getting an acceptance. So that was the lowest rate since the WHO began collecting that data, and 54 Palestinians died awaiting for their permits. Those are the people that they could have directly documented that their death draws back to the delay in care. Obviously, we know that health is a lot more holistic, and there's so many different factors that can go into one's wellness. But those are the people that could just be directly drawn a straight line between the delay of treatment and their ultimate demise. And in 2022, you had a pretty high acceptance rate, only a 17% rejection rate for permits, but that still means 12,000 Palestinians are denied permits, and that's 12,000 lives and 12,000 families affected. I wanted to just draw your attention here to this distribution of spending. Really, the top line is what's most important, purchasing services. So the amount of money that comes to the Ministry of Health in Palestine, 40% of that budget is spent to pay for the care that is happening externally, which means the Palestinian Ministry of Health is handing money over to the Israeli healthcare system, Jordanian, and Egyptian healthcare system to provide that care. That's 40% of the budget. With that 40%, what could it do if we allowed for a sustainable healthcare system to really grow in Palestine? So from 2007 to 2018, the average delay was 77 days. The delays have only grown higher since 2018. And there have been studies that show that it has an increased risk of mortality, especially with cancer patients and those requiring cardiac interventions such as catheterization. And since 2001, as you can see from this graph, the number of permits and referrals going outside is increasing. So even if you have something as what seems like a small number, like 15% of rejected permits in 2022, that still is thousands and thousands of people. And there's also requests for entry of equipment because they can't just come in on their free will. People can't just order this equipment. There always needs to be an approval from the sovereign occupying authority. And then 120 requests in 2021 this began actually, I believe, in beginning of 21. By February 22, only 30 were approved. And they were actually rejected because there was thoughts of ulterior use or ulterior motives for a CT scan and an X-ray. So the border is really something we really need to examine when it comes to the transfer of care. So in the West Bank, 94% of transfers to hospitals in East Jerusalem were subject to delay due to a policy where a transfer has to occur from a Palestine registered to an Israeli registered ambulance. This requires unnecessary paperwork, jumping through these bureaucratic hoops, and at times it really just comes to the mood of the person that's at the border. Just today, a boy who was around the age of 8 or 9, his name is Ahmed Muhammad Sammar, he died in the ambulance. He died in the ambulance as he was rejected exit outside of Jenin just today. So this is something that does exist, and people do die because ambulances are not allowed to pass through, or there is a delay of transfer. And 50% of the patient population in East Jerusalem hospitals come from the West Bank and Gaza. So that's a significant amount of sick people. And then I wanted to just mention that the border is not only the locus of violence and direct and structural violence, it's also the home. Demolitions are made because of homes are made because there's claims of no permits. So 95% of permits in Area C are denied. So people try to, get a permit, do things the right way. But a lot of those permits are rejected. And then they're accompanied by violence from settlers and then being pushed out by the government. Sometimes it's a slow process. Sometimes it's as rapid as a bulldozer coming and destroying your home. The graph here shows the increase in incidence of settler violence when it comes to property damage or casualty. You can see that it's only increased, and it goes up to August 2023, which really takes us to just about the moment that we're in today. So in effect, this creates a manifest and stark difference in health inequity, a 9-year difference in life expectancy, and a 6-fold difference in infant mortality between Israel and the occupied territories. That is massive. Since 2022, you've had over 1,000 people being displaced from their areas of residence. You've had over 240,000 people being referred, and a good amount of them not being able to get care, and of the people that were able to get care, a lot of them were not able to have their families accompanied, which can be really traumatizing for children. And there's actually tons of cases I've looked through of pediatric cases where they just weren't allowed their parents to come with them, and they go to a foreign country alone. Um, Another thing to really highlight here is that 5 million Palestinians in the occupied territory were not included in the COVID-19 vaccination program. However, the 600,000 plus settlers living in those same territories were included in the vaccination program. So we also want to talk about past offenses before, really understanding the extent of destruction of the healthcare system in Gaza. So in 2021, you had, 100,
Chota?
169 incidents of violence against healthcare workers, and 30 healthcare facilities were damaged or destroyed. You had 53 instances of violence on healthcare workers. And in the Great March of Return, which Dr. Mekdashi had talked about, which was an entirely peaceful march, over 300 healthcare workers were injured and 2 were killed. One of which is pictured here, Yazan Nagi, was murdered by an Israeli sniper while she was tending to an individual's wounds. So I'm just going to move along in the interest of time, but this really just highlights the social determinants of health and what has been rejected for most of Gazans. So the public health crisis. Gaza's water supply comes entirely from an aquifer. It's been depleted and damaged, and seawater intrusion, wastewater seepage, and agricultural runoff, in addition to the pollutants that come from explosives and that seeping into the groundwater, that is all being compromised. And there's really just this aquifer that provides clean water, because they're not allowed to build desalination plants and don't have enough power really to do so. So pre-October, since the beginning of the attacks, groundwater production is less than 5% of what it was before, which was minimal. And 97% of drinking water in certain studies, this was from 2018, was found to be unfit for consumption. This is 2018 we're talking about. So right now, you have more than a quarter of all reported diseases in Gaza being caused by poor water quality and access, and you have increased cases of dehydration, diarrhea, waterborne illnesses, hunger, skin infections. And then before all this, an average of 1 toilet stall per 75 children and 1 sink per 80 children in schools in Gaza, which, as we know, is just asking for for spread of infectious diseases. Food insecurity is huge. The food that's entered Gaza, this was from a report in late November, was 7% of the daily minimum caloric needs. I think that number is probably smaller now. In 2022, it was found that 1.84 million Palestinians are food insecure, 1.1 million of them being severely insecure. 90% of those that are severely insecure are in Gaza. And this is not something new. Since a study in 2003 showed that 70% of Palestinians were food insecure, both in the West Bank and in Gaza. And attacks on agriculture are consistent. Farmlands are razed and destroyed. The man here that you see, Bilal Al-Sawiya, is a village near Nablus. He was picking olives and he was killed by settlers just a month ago. This man was holding the symbol of international peace and solidarity, the olive branch, and was killed for no reason. So our farmers and those that grow food, their lands are threatened and their lives are threatened. And, explosives have lasting effects on the land and sustainability of agriculture. So chronic diseases are also really important to think about, because chronic diseases require consistent management. A lot of us in medicine know this: diabetes, CVA, cerebrovascular accidents, cancer, all that requires consistent follow-up, and that is completely complicated by the permit regime and access to medications. The increase of dust and rubble and phosphorus and all these sort of infectious agents from explosives can only increase the rate of chronic respiratory illnesses. We do not know the impact of this, and we won't see it for years into the future, right? So the incidences of non-communicable diseases are pretty high: 57% in the West Bank, 40% in Gaza Strip. And right here, if you want to I'll read a quick one. This is an account of a cancer patient from the West Bank talking about their experiences with treatment. So this study was in 2021, from September to November 2021. My health insurance was stopped. if I wanted to go and renew my health insurance, it would take me months, and I don't know what would happen to my health state. And then another patient said some days when the medication is there and other days when the medications are not there. We also face this because medications come from Israel, and Israel gives them according to the number of patients they have. It does not give them in large quantities, only based on the exact number of patients who need it. So when you have the unpredictability of a permit system and people come in and out at an uncoordinated way, you're not going to have enough medications to serve everybody. So women's health is incredibly important to consider right now in Gaza. When the beginning of the offensives in October, there were 84,000 pregnant women, 5,500 anticipated to give birth in October, and many have already given birth. Menstrual hygiene management is completely complicated. People are taking tablets and pills to stop their periods due to the lack of sanitation pads and water for washing. And food insecurity increases risk of malnutrition in children, preeclampsia, hemorrhage, and that can be life or death in mothers. And it really requires emergency services. And with the destruction of roads and ambulances being targeted, women that are experiencing this might just die instantly without seeing or even seeing a provider. So 150 women are giving birth every day, and without antibiotics, as many of us who have done our OBGYN rotations know, antibiotics are key when it comes to giving birth, right? So home births are sometimes the only option, and obviously with the loss of partners and the complete destabilization, increased risk of postpartum depression is very real. And in children, when it comes to children, you have some reports saying over 9,000 were killed, over 1,000 still missing, expected to be under the rubble. 1 in 150 children have died in Gaza. Schools are destroyed. Where are they going to go once all this offensive stops? We know from COVID how the interruption of education can be detrimental to children's health and mental health. 500 to 700 children are detained at any moment in Israeli prisons. In a study in 2022, which compared the mental health of Gazan adolescents from 2018 to 2022 after the 2021 offensive, it showed that 4 out of 5 children and adolescents in Gaza were living with depression, grief, and fear, and more than half had contemplated suicide, and 3 or 5 reported at least one instance of self-harming. Take that into consideration with the amount of stigma that exists with mental illness in Gaza. It's quite alarming. And lifelong injuries and destruction of limbs and amputations, that can have huge effects on people's mental health. And it requires consistent follow-up and interventions that might not be possible right now. So the story of Ahmed Manasra, I just want to get into a little bit. He was falsely convicted at the age of 13 years old. He was at the time beaten by the police and jeered and ridiculed by Israeli public. He was then interrogated, and the video for the interrogation came out a month after he was arrested. You saw in the interrogation that he was basically being tormented to, have a false admission of guilt. He then was sentenced, and he had been in solitary confinement since November 2021. He spent nearly 2 years in solitary confinement in total. This is since he was arrested in 2015. His mental health has deteriorated. He's developed schizophrenia, severe depression, and suicidality. He is currently in a mental health unit, but once he is treated, whatever that means, in their mind, treated, he will be returned to solitary confinement. And there have been no investigations into the conducts of the officers. So we've talked about incarceration with Ahmed's story, but I just want to talk about, there's over a 99% conviction rate. And that is because, one, there's administrative detention where people are held without charge indefinitely. And two, those convicted often accept charges because it takes much longer to await trial than and hope for being found not guilty to then just admit, do your sentence, and be let out. Because there is a law that was inherited from the British that every 3 years one can reintroduce administrative detention. So you can actually be arrested indefinitely without charge in Palestine, even if you were a child. And the Palestine Prisoner Society reported that 95% of Palestinians held in prisons experienced at least some form of torture. So chronic traumatic stress disorder really does describe the situation in Gaza a lot better. You have one psychiatric hospital in Gaza and one in the West Bank each. You have consistent loss of loved ones, consistent displacement, generations of displacement, and you have the highest levels of depression in the Middle East and North Africa within the Palestinian territories, both amongst adults and children. And disability is a huge issue as well. You have 93,000 Palestinians. This is a 2019 study with physical disabilities, 1 in 5 of them being under 18. So mobility, as you can see from the graph, is the biggest issue, but there's also people that are struggle with sight and hearing, communication. In 1987, with the first intifada, 5,000 people have had permanent disabilities. In the first intifada, the Prime Minister Yitzhak Rabin's policy was the breaking legs policy. So it was a peaceful demonstrations mostly, and many of those who were demonstrated had their legs broken, and 80,000 people had these serious injuries. And there's also lack of support for children with intellectual disabilities, both in the West Bank and Gaza. You have an already strapped mental health support system there. And with the chronic power outages and electricity access being compromised, people's mobility and assistive devices are also compromised. So when it comes to surgery, this is a picture of Dr. Midhat Saidam. He was one of 3 board-certified burn surgeons who was killed in Gaza. Another burn surgeon was also killed in Gaza, so one only remains. There are severe limitations in staff. You don't have the correct equipment for screws and implants, so people's injuries are going to heal wrong. And there's not a single trauma surgeon in all of Gaza. So in the case, for the interest of time, I just want to move through this. But things we've heard, household vinegar has been used as a disinfectant. There's been a shortage of bandages, so people have been using clothes, which increased risk of wounds for large infections. And then, ICUs, the bed burn units, are completely overcapacitated. You have 70 patients plus in a 10-bed unit. So finally here, and this is where we end, and this is just the biggest shock. In a matter of 2 months, consider all these hospitals that have been destroyed. All of us that work in healthcare, we know each hospital, each healthcare system is its own universe, and that has been destroyed. The people who have lived it have been threatened and killed and injured. And you have, some of the largest hospitals completely out of service now. Al Shifa, we heard a lot about that in the news. So the number of functioning hospitals is down from 36 to 18. Clinics have fallen from 72 to 46. Bed occupancy is over 170%. Some hospitals, it's over 200%. And as it stands now, there are very few fully functioning hospitals and clinics in Gaza. And many healthcare workers are living under threat of death and violence, and are, really sacrificing their lives to support their people. And this event is also to honor those people. So I thank you all for being here, and yeah. If anyone has any more questions, we can discuss later.
Our next speaker is Dr. Omar Dawachi, Associate Professor of Medical Anthropology and Global Health at Rutgers University. He's an Associate Professor at Rutgers. His work examines the social, medical, and environmental fallouts of decades of war and violence in Iraq and the broader Middle East. Before he joined Rutgers in 2018, Dr. Dawachi
co-founded the conflict medicine program at the American University of Beirut, where he taught social medicine and global health. Dr. Dawachi holds an MD from Baghdad University, an MPH from the American University of Beirut, and a PhD in anthropology from Harvard University. And he was one of my professors in undergrad. So warm welcome to Dr. Dawachi.
Can everyone hear me? Good? Great. I'll do something a little bit different for this presentation. I think it kind of flows beautifully after these are 2 incredible presentations. We had a kind of an overview about history. We had a kind of cross-section into what does the healthcare system looks like. I want to take you through a journey of a physician throughout from the beginning of the conflict, throughout the first 2 weeks of the conflict. And this is my colleague, Ghassan Abu-Sittah, who actually was in Gaza for about 14 days and then eventually had to leave because he was unable to operate anymore. But I want also to use this point to kind of just a little bit have some kind of main ideas for us to think with. as we watch the video and as maybe we can maybe discuss afterwards. What we see today in Gaza is really a process of ethnic cleansing, a process where healthcare has become weaponized, through which you are creating or manufacturing a public health dystopia. You're creating a kind of a world that is going to be unlivable, uninhabitable by those who survive this conflict. And the idea of targeting healthcare or how healthcare becomes a target of war is not necessarily new, as I think Yazan mentioned that in Gaza, targeting doctors, targeting ambulances, medics, healthcare infrastructure has been ongoing, and part of my work has been really looking at some of that history. As a physician who worked in Iraq in the first Gulf War, where all the infrastructure of public
health was destroyed, and then Iraq was put under like
the harshest sanctions ever put on
a country for almost 12 years.
Almost
500,000 children
died because of these sanctions that were imposed by the United Nations and also the United States and Britain. And at that time, as an experience, it became very clear to me what does it mean for healthcare to become a target of war. Although we are not fighting, there was no clear enemy, but we at the hospital, as doctors, were feeling that this is the frontier. This is where the war was being waged. Over the next decades, I left kind of clinical medicine, studied public health, and did anthropology, but returned back to medicine as I would call myself a healthcare practitioner, someone who works on both research, policy, looking at the region's kind of healthcare unfolding or unraveling during the war on terror. And what we saw in what we see now in Gaza has been seen before in other places, has been seen in Syria, has been seen in Mosul, has been seen in Aleppo, has been seen in Baghdad. The destruction of healthcare has become increasingly a strategy of war. And we are kind of confronting a kind of an existential crisis as healthcare practitioners, because we've kind of thought always of the clinic or of medicine as part of the infrastructure of statehood, part of the kind of the state building, statecraft, but we've kind of moved now from the birth of the clinic to the death of the clinic. So what I want to do today is share with you the experience of my colleague, Dr. Ghassan. Ghassan and I met 12 years ago in Beirut, where we kind of started working together on war injuries. And we thought that always the wound or wounds that we saw out of these wars tell a lot of stories. They tell clinical stories, they tell social stories, they tell histories, they tell politics. They are archives of these conflicts. So I want to start first, and I want to give a bit of a warning, trigger warning, that I'm assuming many of you are medical students, you're kind of a little bit used to
harsh images. I want to show a 2-minute video. If you're uncomfortable, please leave the room. We might have to put it on a browser. But let me just, before we start, I will give you the context. After Ghassan left Gaza, I flew to London to be with him for a week. And part of what I was doing, I wanted to kind of help in the decompression. I interviewed him for hours, sat down with the camera. I don't have the footage from that, unfortunately. I need a lot of work to do this. But I have a video of the press conference before he went to Scotland Yard to testify in war crimes accusations against the Israeli state. So one of the things that is now happening is moving through litigation through the kind of narratives around what has happened to the medics and the doctors, is to kind of try to document this history. And I think this brings us to the role of many of you as doctors, as witnesses of inequalities, of injustices, of the catastrophe that is happening to the human body. And I think this story really captures all of these things. Enter.
Many civilians. I saw a baby as well. People are removing the carnage. Brave people are removing the carnage. Removing Hatem, my beloved friend and relative. Another massacre in the heart of Khan Yunis camp. 22 houses in this place, 4 buildings were brought down by many F-16 bombs this morning, the 26th of October. They have recovered 25 bodies, and you can see over there that they are still recovering more bodies. 25 have been recovered. It's obvious the scale of the damage over there. And in the entire area, 22 houses completely broke down, 4 blocks of flats, without any warning. Men, women and children are below. This is indiscriminate bombing, this indiscriminate targeting of the Palestinians.
Okay. And then I want to.
Over 10 doctors who have been arrested openly or have been disappeared. And to start with, I arrived in the Gaza Strip on Monday, the 9th of October, in the early hours of the morning. And that was a decision that I made on the night of the 7th of October, having realized that Gaza was about to face a extremely brutal and vicious attack. I reached out to my contacts at MSF, who arranged for me to travel to Cairo on Sunday and then make it across the Sinai Desert in a car to get into Gaza, with the feeling that usually in these conflicts there's a small window at the very beginning that you can use to get in. On arrival to the Gaza Strip, I went to a family house, but within half an hour, the whole neighborhood had been telephoned by the Israeli army and informed that particularly the tower blocks behind the house that I was in were going to be targeted by the Israeli Air Force. Almost the whole neighborhood was in the street trying to run away. I then moved to another house, and we were pinned down that night because of the severe bombing. In the early hours of Tuesday morning, when there was a lull in the fighting, I managed to go back to the damaged building that I had evacuated and pick up my suitcase and then walk to Shifa Hospital from there. And from there on, I joined the plastic and reconstructive surgery team at the burns unit at Shifa Hospital. During my time at Shifa Hospital, it became apparent that 40 to 45% of all the wounded were going to be children. That there were, the primary target of the bombing was people's residential homes, and that we were getting multi-generational patients from the same families in each air raid. Most of the injuries initially were blast injuries, and these were severe soft tissue traumas, severe facial traumas, multiple fractures. And then as time went, we saw the introduction of incendiary bombs, where the patients would have over 40% of their total body surface area burnt with no other injuries. And by the time Shifa had collapsed, there were over 100 of these patients at Shifa Hospital. And we started seeing phosphorus burns. I had treated white phosphorus burns in the Gaza Strip during the 2009 war and was very familiar with the very characteristic injuries and burns that they make. As a chemical burn, phosphorus burns burn right through to the inner core of the body and only stop when they have no exposure to oxygen. And so the burns would be, the patient would be basically puckered with burns that core right into the ribs, the bones, and unlike thermal burns that spread from the surface more horizontally. We also started to notice the increased use of fragmentary missiles. Patients were coming in with very unique injury patterns. In normal blast injuries, the wound edge is covered with soot and is burnt, and there's a lot of rubble, dirt, clothes, metal inside the wound. These wounds were very clean cut, unlike blast injuries where the amputation happens at the weakest part of the body, like the joints. These patients were having guillotine amputations in extremely tough parts of the body, in the mid-thigh, where you have to work your way through all of the muscles of the thigh, and the thigh bone, the femur. And they had serrated edges, as if what they had been hit by was a saw. Really, by the day 4, day 5, half of my operating list, which was around 10 to 12 cases every day, starting at 8 or 9 in the morning and finishing at 1 in the morning, were children. My estimate is that there are now between 700 and 900 children with amputations of limbs, in some of whom multiple limbs have been amputated. On one night at Al Ahli Hospital, I performed amputations on 6 children. At one stage, when there was a call from one of the plastic surgery teams further up north at Al Auda Hospital, which is an NGO hospital where MSF has a base and a unit there, in Jabalia camp. I moved to Al Auda Hospital from Shifa. On the 3rd day that I was there, and in front of me, I witnessed a phone call by the Israeli army to the medical director of the hospital. And he was informed that unless he evacuates the hospital within 2 hours, the hospital was going to be targeted. Of course, that was not going to be possible. First of all, the job of the hospital is only to leave once all of the population is left. And 2, that there were many patients that were too difficult to move. We evacuated the patients that had been operated on, were recovering from their injuries, and I moved back to Shifa to rejoin the plastic surgery team there. While in Shifa, the number of burns and the number of pediatric injuries were increased, one of the most horrific scenes that I witnessed in Shifa Hospital was when, after the air raid and the dead and the wounded were brought in, members of the Shifa medical staff and nursing staff would be running frantically in the emergency department, looking at the faces of the wounded and the dead to see whether their relatives had been amongst the wounded, and in many cases their children had been amongst the dead and the wounded. At one point, one of our colleagues, Dr. Midhat Saydam, while at work, his sister came with her children because they had been forced to evacuate their home. He decided to just take them to his house where his other siblings were taking refuge. And a few hours later, he was killed along with all of his siblings and their children. His children and his wife were buried under the rubble and were only saved 24 hours later. Dr. Midhat Saydam became one of many doctors that were killed, and we discovered after I came back and after the ceasefire that another member of the plastic surgery team, a nurse working at the burns unit, was also killed with his brother when their house was targeted. At what point the discussion was with Al Ahli Hospital, because of the overwhelming pressure on beds at Shifa. We had over 2,000 wounded in a hospital that had a bed capacity of 600. The decision was that I would move to Al Ahli Hospital, which we felt was safe because Al Ahli Hospital, as you all know, is owned and run by the World Council of Churches and managed by the Church of England here. On the morning of the massacre at Al Ahli Hospital, I moved by ambulance from Shifa Hospital to Al Ahli. Al Ahli is the oldest hospital in Gaza. It had at some stage been called the English Hospital because it housed, and it was the hospital in which British soldiers during the First World War were treated. And it was full of plaques that families of British soldiers had dedicated to their loved ones. When we walked in to the hospital, I could notice that what had been happening in Shifa was happening at Al Ahli Hospital. The hospital was turning into an internally displaced camp. There were lots of children and families in the grounds of Al Ahli Hospital. I went, I saw the patients, made a decision whom to operate on, made a list of 10 patients that needed surgery that day and another 10 that needed surgery the following day. And around 12 o'clock that morning, we had a visit from the CEO of the hospital and the medical director, Dr. Maher Ayad. What had happened in the days before is that also Dr. Maher Ayad had received a phone call from the Israeli army ordering him to evacuate the hospital. A day later, when he didn't, the Israeli drones fired 2 missiles at the fence of the hospital. And then he had received a second phone call from the same officer berating him for not having evacuated and telling him that unless he evacuated, the hospital was going to be hit. The reason why we had the visit from the management team is that they told us they had been in touch with the bishop in London and that he had received reassurances that we could carry on our work. By 5 o'clock, I had made this decision that I needed to operate into the night and start early in the morning, and upon discussion, we made a decision that I would stay over and continue working at Al Ahli. Later on that evening, between having wheeled out one of the patients and we're about to bring the next patient in, and there had been in the few hours before a lot of bombing around the hospital, and you could kind of feel it shake. There was an almighty whistling sound coming towards us, kind of indicative of missile, and then a huge explosion. It was obvious from the size of the explosion and the damage that it was either at the edge of the hospital or within the hospital. The false ceiling in the operating room fell on top of us. Luckily, I wasn't injured, and I walked out of the operating room into a corridor that you could see the forecourt of the hospital in, where the families I'd seen the families earlier on. The ambulances were on fire, some of the cars were on fire, and the forecourt, which had been lit by that fire, was full of bodies and parts of bodies. I made my way through, and you saw some of the video there. That's a video that I took at Al-Ahli, through the survivors trying to get to the other end of the hospital. I went to the emergency department. The first patient that I saw on my right was a man in his mid-50s with an amputation at the level of the mid-thigh, similar to those guillotine amputations that I was telling you about. And there was blood spurting through the exposed arteries in his stump. I took his belt and tied it as a tourniquet, and then set about trying to find someone's shirt to take it and tie it as a second tourniquet, and try to resuscitate him. Once I was satisfied that he had been stabilized, I moved on to another patient who had received a single shrapnel to his neck, and that shrapnel had hit one of the vessels in his neck, and blood was spurting out of the neck. I put my hand on the wound to try to stop the bleeding, and found someone else to put their hand, and started resuscitating that patient. While I was resuscitating the patient, the ambulance staff started to arrive, and I had a tap on my shoulder, looked behind, and there was a stretcher with some paramedics. We moved him to the stretcher. I kept my hand on his neck so that we'd stop the bleeding, and helped carry him outside, and we walked out into the forecourt to try to get to the ambulances. And that's when I saw the full extent of the carnage in the forecourt. Not only were there lots of dead bodies, but there were also parts of bodies, and I remember walking past the amputated forearm of a child. I took him to the ambulance. I then went with him to Shifa Hospital, and that's when the rest of the wounded came. From Al-Ahli to Shifa as they were brought in. And then when we had triaged and stabilized the patients and sent them up to the operating room, I went in and rejoined the burns unit at Shifa Hospital. For the following few days, I just rejoined the team at Shifa Hospital, and we were seeing more and more children, more and more burns, but we were also seeing a phenomena at Shifa, which by the time Shifa had been completely surrounded by the Israelis, there were 120 children at Shifa Hospital who were wounded children with no surviving families. Some of whom were too young for us to even know their names. These had been taken out of the rubble, and there was no one left to care for them. There were over 100 major burns, and the bed crisis at Shifa had reached to the point where the wounded were being looked after on mattresses in the floors of the corridors, in the floors of the wards, in the emergency department. I stayed at Shifa for a while, for a few days, until the team at Al-Ahli Hospital was able to fix 2 of the operating rooms and reopen the ground floor so that at least Al-Ahli could be partially functioning again. Because of the pressures on Shifa, where we were less and less able to operate on patients because of lack of medication, lack of consumables, lack of anesthetic, I decided to go back to Al-Ahli, but on a shuttle basis. I would take 5 or 6 patients from Shifa Hospital to Al-Ahli Hospital, operate on them there, and then initially first day come back to Al-Ahli and join the team at the end of that working day and operate, and then go in the morning back to Al-Ahli and take some more cases. That continued until one morning I was in the ambulance trying to go to Shifa because I had promised a colleague whose son had a severe facial injury that I would operate on his son at Shifa. And when we were in the ambulance, I could see at the end of the road Israeli APCs crossing across the street that we were in. And we turned around and came back. That night, we had an influx of patients whose families managed to get them out of Shifa Hospital before it was completely surrounded. But also, we became the only functioning hospital in the whole of Gaza City, and with the exception of the Indonesian hospital, the only functioning hospital in the northern part of Gaza. We started then receiving direct injuries to Al Ahli Hospital, and the Palestine Red Crescent Society, which manages the ambulance service in the Gaza Strip, set up a trauma stabilization field hospital inside the grounds of Al Ahli Hospital. For that period afterwards, we started seeing more and more of these fragmentary missiles. But we also started seeing, and for the first time since I was in Gaza, people with, patients with high velocity sniper injuries. And we could hear the distinctive noise that the quadcopter makes, followed by a single shot. On one day we received 20 patients. There was a mother and child. There were some brought in dead from the quadcopters, and we discovered that these quadcopters had been released in the roads that were leading up to Al Ahli Hospital. These patients, these wounded, were trying to come to Al Ahli to see family or for medical emergencies rather than for wound emergencies, because by that time all of the hospitals in Gaza, including the pediatric hospitals, had been completely neutralized and put out of service. These injuries are very distinctive because the size of the inlet wound to the outlet wound is disproportionate. The inlet wound is a very small stellate-shaped wound, and the outlet wound, where that high velocity, high energy bullet comes out, is bigger than a clenched fist. I remained at Al Ahli Hospital but witnessed the dwindling of the supplies, and some of the patients, especially the little girl whose leg was covered in shrapnel that you saw, we started having to perform extremely painful procedures, including on that 9-year-old girl without anesthetic. Patients were starting to develop wound infections, and at a minimum we needed to clean the wounds so that we can hopefully, once things stabilize, operate on them. The final straw came when a mosque in Sabra neighborhood was targeted. 60 people had been brought in dead, and hundreds were wounded. That night we operated into early hours of the following morning. Around 5 o'clock, I was informed by my colleagues that we had run out of anesthetic and that the operating rooms would no longer be able to look after patients. That's when I made the decision to go to the south, because I had felt that as a surgeon with no access to operating rooms, no access to morphine, no access to ketamine, which is a kind of veterinary anesthetic that we used to use on patients, there was nothing for me to do. And that was day 40 of my stay in Gaza.
I'm not going to say much after this. I think it's pretty self-explanatory. I wanted to show this because I think there is something about the intimacy of working with the body as doctors. This is something that makes much more sense. I think the question for me has been, since the beginning, of this of this war is what remains after war. What's going to happen after the end of this? One of the things that at least my experience has been is some of the nightmares that we've seen in places like Mosul, where has one of the highest rates of antimicrobial resistance in war, in injuries, even traffic injuries, sewage systems full of cocktails of XDRs and AMRs, failure of healing, trauma, families are not able to go back home. The war is never just an event. War is always needs to be thought of as a process that has really long-term legacies, and it's intergenerational and will stay marking bodies for as long for much longer than when the hostilities will end. So I'm happy to later on engage with any questions about the video, about Ghassan's work, about the context of some of these other wars. I'll be more than happy to discuss that. Thank you.
Well, thank you to everyone for being here today, and thank you to our previous speakers. Our next speaker is Dr. Yasmine Elfarra. She's a Palestinian-American alumnus of the Robert Wood Johnson class of 2022 and a current internal medicine resident at New York Presbyterian Weill Cornell. She's passionate about global health, primary care, and women's health.
Hi, can you guys hear me? Or I don't know if anyone can just confirm that. Okay. It's very weird to see ELH. I feel like I was just there learning anatomy, physiology, all this stuff. So it's really weird to be on this end. And I'm sorry I could not be there with you guys today. I just had surgery a few days ago, or else I would definitely be there in person talking about this important matter. So for me, it's really hard to start talking after hearing, of course, all that was just said from the previous speakers. I will try and be as brief as possible and just kind of explain what I went through and why I still believe, despite what I went through, it's still so important to be talking about this. So kind of when all of this started, I was consistently posting about what was happening because my family, I'm Palestinian, but I'm specifically from Gaza, Khan Yunis in Gaza, which is where a lot of the bombing is happening right now. And so I was posting every day updates about my family on social media and trying to keep, obviously, my loved ones on social media in the loop of everything that was going on. And then about 2 weeks after kind of October 16th or so, I was pulled into a meeting to discuss some of the things I had been posting. But prior to that meeting, about 2 hours before, I just found out that I lost 10 of my own family members. And at that point, that would have been 10 out of a total of 30 family members. Right now, it's above 50 family members that I've lost because of the genocide that's happening right now. But at the time, it was 30 family members. And I was working in a cardiology unit. I'm the senior on the team. So I was dealing with a new intern, so I was trying to keep everything organized. And even though I just found out that I lost 10 of my family members, I kind of compartmentalized that, which isn't right, but that's what a lot of us in medicine end up doing. And I sent messages to my family and was kind of feeling emotional in my phone, but no one could notice what was happening. And then I was in the middle of rounds when one of my chiefs pulled me aside and said that you need to go into this meeting with HR and kind of discuss some of the things you've been posting. And to keep that meeting brief, because I know many of you guys have probably seen the video where I talked about it a little bit more extensively. But in that meeting, essentially, I was asked to sit down and go through kind of my Instagram posts, which the most concerning post to them was when I said that this didn't happen in a vacuum. And it's just by coincidence that I had posted that a week before And then the UN general actually ended up saying what I said the day after. I forget the exact timeline, but I basically said what was going on. Anything that happened on either side was not in a vacuum. You know, there's been injustice and medical injustice, as you've been seeing for the past 75 years. And I've seen that personally with the fact that I can never visit my family in Gaza. I've never gone to Gaza once in my life. And my father and my grandfather had to flee Gaza. So I've never been there. So basically, I said this is not this didn't happen in a vacuum. And then they told me, do you condemn terrorism? Do you condemn the attacks that happened on October 7th? And I said, can we just back up for a moment? I'm not ready to talk about politics right now. I just got out of rounds. I just lost 10 of my family members. Can we please pause? I'm not able to, I don't have the mental capacity to talk about this right now, because I was kind of shocked about the conversation. But they pretty much said, I apologize, but we have to talk about this now because we have to make sure that it's a safe environment for everyone in this workplace. And the people who were in the room were respect officers, some of which were physicians. And you can imagine how I felt with them being looking at me like I am kind of this disease, and they have to figure out if I'm good or bad and safe for everyone else, because certainly it wasn't a safe environment for me at that point. And I told them, the fact that you're forcing me to continue this conversation when I just told you that 10 of my family members were just blown to pieces. And the reason why hearing this conversation is, and I'm a little bit frazzled right now, I apologize, is because hearing the in-depth of the accounts that were just said, is I know that's what my family members went through. Because I have seen those pictures myself from WhatsApp messages, not even on social media. And so I said, the fact that you're forcing me to sit here and talk about condemning terrorism and condemning saying that this didn't happen in a vacuum shows that you don't see me as a human. You don't see my pain as equal. You don't see Palestinian pain as equal, because you're just looking at me and you're otherizing me in this moment of my suffering. And that conversation, whether you believe it or not, even though I started on that note, continued on for 2.5 hours, where they basically took post by post and asked me kind of to say that you're sympathizing with terrorism, when again all I was saying is this isn't happening in a vacuum. And one of my posts said, I just lost 30 family members, and I cannot continue friendships with people that stay silent about this. And that's my right to choose who I want to be friends with or not. But again, I was talking about how I just lost 30 of my family members to that point. And really in that moment, in that 2.5 hour conversation where they tried to get me to a point where I would shut down and I wouldn't be speaking anymore and I would just be afraid, it really just made me even more passionate about speaking out, because I realized that they were clearly in a delusion of what was actually happening if they had no emotion towards me and towards my family and were still able to continue this conversation. In that moment, I realized that, and I say this all the time, and I told this to their face, I said, you guys are trying to make me feel intimidated and make me feel like I should be grateful just because I was a Palestinian and I'm a minority and I got to the point where I'm at a prestigious institution. You want me to feel grateful that I have a seat in this room. But in the reality, you guys need to be grateful that you're hearing my voice and hearing my position, because if you're so numb to my suffering that you're forcing me to have a 2.5 hour discussion condemning terrorism, that is exactly why I need to speak up. That is exactly why I won't stop talking about what's happening in Palestine, because of how numb you are. I said, Palestinians, and I'm privileged, I'm privileged, I was born and raised in the US, but Palestinians in general have to act like suffering is normal. And we're just expected to say, if you're suffering, if people die around you, that's normal. But it's not normal. And I told them, I'm still working here today when I just lost 10 of my family members and saw pictures in my phone. But I'm still here because I have a duty, because if I can't just get out and leave the hospital right now, I mean, I could, of course, all of us should prioritize our mental health, but I felt this tremendous guilt. How am I leaving the hospital because I feel sad that my family's dying when they don't get a break? So I stood there and I was working in the cardiology floor. But I said, any of you guys just found out that 10 of your family members died, I promise you would not be working here. You would not be sitting in this room right now. You would be given the courtesy of going home. But I have to be here right now and explain to you why it angers me that my family is dead and why it's important for me to speak about how I don't want them to continue to die. And they said, it's not our job to solve the conflict right now. And I said, you're right, that's not your job, but it's your job to make me feel safe. And it's your job to make everyone in this community feel safe. So I won't go in depth and explain the nuances of everything that happened. I'll leave it up to the people who organized this to send my whole, I was asked to speak at different events about kind of what happened in this media platform, and I kind of explained it a little bit better so I'll ask them to send that speech to you guys so you could hear it a little bit better. But my main point is that people throughout the world will try to make you feel afraid of speaking out against what you feel is right, but you no longer have the privilege of doing so if you're especially if you're a doctor. If you see a person is being, if the injustice is happening to a person, and you see that medical injustice is happening to a person, just like we see in Black communities and specifically with women in health, there's whole organizations in medicine advocating for those groups. Palestinians are also one of the biggest groups that need to be advocated for. And if you ask, why does this matter if I'm a US physician? Why does this matter if I'm the US? Beyond the fact that it should matter regardless, because of course, doctors have global health initiatives that the US is not even involved in certain countries, but doctors go to these countries. But the US, and I'm not going to go into it now, is very much involved in what's going on right now in Palestine, especially financially. So it is exactly your job as a US citizen, but especially as a doctor, to advocate for all marginalized communities. And Palestine right now is one of the forefront of a marginalized community. Women, children, the list goes on. I won't say, Yazan said it better than me. I won't go in depth on that. But that's really what I want to say. I don't want to take away from any time from any of the other speakers. But if anyone wants to talk to me outside of this, feel free to reach out to me. And just always remember, especially if you yourself are a minority, don't make other people make you feel afraid and make you feel like you're lucky to be where you are, and so that you should be quiet because of it. You got there because of you deserve to be there. You got there because of your own hard work, and if you have something to say, it's just as important as anyone else. And so that's kind of all I have to say. Thank you for having me, guys, and it's so good to see you guys all in ELH now.
Thank you, Dr. Elfarra, for your moving testimony. I have the honor today to present our last speaker of the evening, which is Dr. Ben Thomson. Dr. Thomson is a Toronto-based general internal medicine and nephrology physician who has been going to the occupied territories of Palestine since 2013. He was one of the creators of Empower Gaza campaign in 2015, which fundraised and delivered solar energy systems for hospitals to overcome power blackouts. He created the Key of Health charity to enhance medical education in low and middle income countries. He has taught in medical schools in Gaza since 2013 and commonly does clinical work in Gaza. He has worked in Shifa Hospital during 2 rounds of bombings and also has as a field medic during the Great March of the Return in 2019. Let's welcome Dr. Ben Thomson.
Thank you so much. It's an honor to join you. Wonderful to hear Dr. Maya, Dr. Omar, Dr. Yazan, Dr. Yasmine, really heartwarming. And the last 2 months, I have frequently been lost for words with the experience that many of my colleagues in Gaza and in Canada and the United States have experienced. And I really was lost for words, really quite horrified with the exhibits of anti-Palestinian racism that many of us have experienced. And I'm really sorry you had to go through that. Some of you may know me as the Canadian doctor who was suspended after he spoke up for Palestine, and that's true, but I have been going to the occupied territories of Palestine since 2013, including both West Bank and the Gaza Strip. I was there in September of this year. Unfortunately, I left on September 23rd. Unfortunate, because if I had left a couple weeks later, I would have been able to assist after October 7th. Many of you know these numbers. They have been discussed already this evening, and I don't want to focus too much on numbers because there is so much behind these numbers that we need to discuss. As of this morning, though, there have been over 18,000 Palestinian people killed, at least 8,000 of whom are children. Unfortunately, these numbers are difficult to appropriately estimate because after November 16th, the mechanisms with which the Gaza Ministry of Health was measuring and accurately collecting this data were significantly disrupted. There's at least 49,000 people who are injured, thousands of whom are critically injured. Because the majority of hospitals are out of service due to being bombed or lack of fuel, there is nowhere close to enough capacity to manage even a fraction of the patients who are critically injured. There are almost certainly thousands of people in rubble. So these numbers that I'm providing you are dramatic underestimates. Approximately 85% of the population has been internally displaced, the majority of whom are currently in United Nations shelters. Unfortunately, of the 154 UN shelters in Gaza, 43 of them have already been hit in airstrikes since October 7th. Recently, 2 days ago, the Beit Lahaya school, which was serving as a UN shelter for 6,000 internally displaced people, was evacuated. Men were stripped and detained, many of whom have subsequently disappeared. And that school was then set on fire and destroyed by the Israeli military. So we've seen these numbers. And really, where do we go from here? I think I need to be very explicit that what we have seen is exceptionally good evidence for extensive war crimes. This has not been reported just by me. This is reported by Human Rights Watch, by Amnesty International, and the United Nations. You've heard tonight about a 75-year history of oppression of Palestinian people, the ongoing history of forced displacement, a continuation of the Nakba, which continues in front of our eyes as we see people from Israel telling people in northern Gaza to move south, and more recently, people in southern Gaza, the Khan Yunis and Rafah communities, being told to move and then being bombed while they move, or being bombed while still in their homes before they move. I am going to discuss the hospital strikes. There have been 24 different hospitals in Israel struck since October 7th. While the whole world argued about who struck Al-Ali Baptist Hospital, there have been 24 other hospitals bombed that Israel didn't bother to deny that they bombed. I want to go over, so I am a physician. I have testified to the International Criminal Court for war crimes that I've witnessed. I've taken courses at Johns Hopkins University with regards to humanitarian law as part of graduate studies in humanitarian health. So I consider myself qualified to talk about war crimes, certainly not as well as an international humanitarian lawyer, but I will be discussing a few of those things tonight. But I do want to go past the numbers. I want to tell you about some of the specific doctors that I know or knew before they were killed, and how much their being killed has impacted the way in which we understand Gaza. This is a picture which is not much different from what many of the students in this room that are watching this talk will have experienced. On the far left is Dr. Ayman. He was on rounds. This is in Shifa Hospital, the main hospital in Gaza City. This is a picture from 2018. With him are 4 medical students and an internal medicine resident. Dr. Ayman in this picture was the head of internal medicine at Shifa Hospital. When I used to go to Shifa Hospital and Dr. Ayman was there, I used to do rounds with him. And so he'd always demonstrate exceptional level of compassion, dedication to teaching. He and I would frequently take turns doing rounds when I visited, and I really admired the way that he did it. He was able to put patients at ease in front of patients in stressful situations. Now, he was killed in an Israeli airstrike in 2019. And in fact, on the same day that he was killed, the Ministry of Health building in Gaza was struck, as well as the clinic that was immediately adjacent to it, where all the HIV, hepatitis B, hepatitis C, and COVID-19 testing was performed. So for weeks at that time in 2019, there was no testing for any of these conditions done. So the Ministry of Health had to make the terrible, difficult decision between transfusing blood that could be infected or alternatively letting bombed people in Gaza bleed to death. Needless to say, I'd like to say that kind of decision is exceptionally uncommon in Gaza. It isn't. It's actually the opposite. It's very common. When I was there this September, there were severe shortages of medications, as always. In fact, over the last 5-year interval, the United Nations estimates that 50% of critical medications on average are in shortage. Most patients were receiving suboptimal medication regimens when I was there in September. This means more side effects, less effectively controlled chronic medications, and frankly, more suffering. Dialysis was also being rationed when I was there in September. Typically, dialysis units in the United States would operate on 3 shifts per day, morning, afternoon, evening. Because of the dramatic rise in the need for dialysis facilities, they were doing 4 shifts, which means that the machines were not being effectively cleaned between treatments. And more recently, since October 7th, given patients had to move from the north to the south, one of those dialysis units in the north is no longer accessible. And so they are now running 5 shifts a day. And unfortunately, that means that the machines are not being cleaned at all. And patients' dialysis is now being rationed. Many are getting maybe 1 or 2 treatments a week. And needless to say, my colleagues who are in nephrology are telling me about half the population who are dialysis patients have passed away for one reason or another since October 7th. Now, this gentleman is one of those kidney doctors. This is someone that many of you probably saw interviewed on Democracy Now! And several other media sites. Dr. Hammam was a very, very good friend of mine. I've known him since 2013 when I did my first trip to Gaza. I ate with him and his family at his home in September, and we discussed a lot of important education projects. He was really a bright light in the education system in Gaza. He had already shown himself to be quite a star in medical education. He was already teaching at Al-Azhar University and the medical students. He was exceptional at teaching internal medicine residents as well as medical students. At the time that I was there in September, we were meeting quite a bit because we were creating a board certification program for nephrology with one of the other doctors I'm going to show you, Dr. Rafat. And we'd already met with the Palestine Medical Council, and we'd submitted paperwork for this board certification process to be started, hopefully towards the middle of 2024. I also spent quite a lot of time with the Minister of Health, Dr. Youssef, who had put Dr. Hammam on a hot list basically of superstar doctors that needed to be located at Shifa Hospital to optimize the exposure of residents and medical students to him, to assure that there was as much learning as possible from him. Dr. Hammam was killed in an Israeli airstrike on his home, November 12th. Now, he was killed with his brother-in-law, father-in-law, and father. Now, despite what's been reported publicly, His wife and children were actually in his home when his house was bombed. They survived, but both his 4- and 5-year-old children who were in his home when the home was bombed were by his bedside when he bled to death in his home. They will need to live with the trauma of that. And also, it's worth noting that the ambulance couldn't reach his home. The ambulance was blocked. He was bleeding to death. He could have been picked up by an ambulance and brought to the hospital, but the ambulance was forbidden to go to that region. And so he bled to death in his home with his 4- and 5-year-old children next to him. We talk about post-traumatic stress disorder in North America. Such a thing does not exist in Gaza because the stress is continuous. There is no post. A person who is 16 years old has already gone through at least 4 rounds of bombing in Gaza. That is the nature of childhood in Gaza. But keep in mind, with Hammam's death, we talk about there being 283 healthcare workers who've been killed since October 7th, but there's a lot more. With him, obviously, I lost a friend. Gaza lost an amazing physician. But consider the future of medical education for nephrology and internal medicine, the huge loss that also happened. This is Dr. Rafat Lubab. The first doctor I showed you, Dr. Ayman, was the head of internal medicine. And after Dr. Ayman was killed, Dr. Rafat Lubab took over that position as the head of internal medicine at Shifa Hospital. He and I, again, spent quite a lot of time together when I was there in September because we were working together with Dr. Hammam to set up these improved education programs. Rafat had already set up an international journal club, the first of its kind in Gaza, which had recruited physicians from Oxford, from University of Toronto, many other universities around the world to present cases and also to enhance education for internal medicine residents in Gaza. It was really opening the world to Gaza, something that was really hard to do given the technical challenges that Gaza suffers, but something that Dr. Rafat was able to do. And I remember when I initially met him in 2020, he didn't know my face. We'd never met, but he remembered the name of my fiance from an email message that I'd sent him like a year before. And even before we were talking medicine, he was giving me marriage advice. Just an amazingly kind, compassionate man. And when we met the dean of the medical school at one of the 2 medical schools in Gaza, at Al-Azhar University, he actually pointed to one of the anatomy samples in the anatomy lab and gave me a big smile, and he told me, "That's my gallbladder." So he asked me if Canadian doctors give their organs to their own students, as if, that's the level of sacrifice that we're willing to give our students in Gaza, and I laughed. But Dr. Rafat was killed in an Israeli airstrike November 17th in his home with his family. He also bled to death waiting for an ambulance that couldn't get to his house, as it was also refused it was declined. The ambulance that tried to come was turned back and not allowed to come to his house. Just like Dr. Hammam. This is Dina Al-Haj. She actually did some training in Glasgow in Scotland, but she worked in the World Health Organization pharmacy as part of the emergency trauma team. She would often greet international guests with tea and a smile. And she was one of the first people I actually saw in September at Shifa Hospital, because you have to walk by that pharmacy sort of when you walk in. She called me Dr. Kila, and Dr. Kila means basically kidney doctor. But she'd yell, Dr. Kila, and with a big smile. And in fact, I saw one of her relatives a few years before in one of the specialized kidney clinics I saw. She never forgot me. She always remembered my face every time I came in. She was killed in an Israeli airstrike with her 6-month-old child, her husband, and brothers in early December. This is Dr. Medhat Mahassan. He was actually one of the first doctors I met in Gaza in 2013. I met him again in 2014. He was running the Wafa Rehabilitation Hospital. And this was one of the only rehabilitation facilities in Gaza for complex injuries, of which there's many in Gaza. It was completely destroyed by an Israeli airstrike, the Wafa Rehabilitation Facility, in 2014. Dr. Medhat actually wasn't a surgeon, he was a dentist. And a bit of an odd person to run a facility like this, but he had a vision to reconstruct the destroyed Wafa Rehabilitation Facility after it was destroyed. And so he made a number of international partners, fundraised for it. After securing the international funding, he rebuilt this facility better than the initial facility. And in fact, he managed to get enough funding to build a seniors home facility immediately adjacent to the Wafa Rehabilitation Facility. So really, he was a perfect person given his vision and passion. On November 18th of this year, the Wafa Hospital and the adjoined seniors facility were both bombed. And in that bombing, Dr. Medhat was killed while working with several patients. So in a time with thousands of complex injuries in Gaza, the only place in Gaza to manage complex injuries is bombed. So I want to talk a little bit about my connection with Gaza. So I initially came to Gaza in 2013 as part of a World Health Organization needs assessment to try to establish where investment, international investment, should go to optimize health outcomes in Gaza. After spending a month there and talking to dozens of doctors, health officials, looking at all the hospitals, all the outpatient facilities, I wrote up a report with 67 different recommendations for action, and specifically where money should be placed to enhance health outcomes. As months went by after I got home and multiple contacts of the WHO and the health authorities in Gaza, it was very obvious that none of my recommendations were going to be converted into action. A large part of that happened to do with the fact that most of the promised investments, most of the promises were broken. Most of the money didn't come. And I recognized that if I was going to see any of those recommendations turn into action, I had to take more of a role myself. As it turns out, as a healthcare official, that's pretty easy. As a healthcare professional, it's very easy because there's a lot of needs in Gaza. I am a medical educator by trade, and I'm a healthcare professional. So where I thought one of the things that I could do is create a program to enhance medical education in low and middle income countries, thus the creation of the Keys of Health Fellowship, which identifies critically needed subspecialty needs in low and middle income countries by working with local health officials, and identifies talented physicians to come to Canada for additional training, to get board certified, and then to return back to their low and middle income country to be a champion of health in developing capacity, but also enhancing medical education in that specialty. Since 2013, we've identified, trained, and returned 26 different physicians to the occupied territories of Gaza. One of those physicians, and I'm not going to show you a picture for her own safety. One of those physicians, I'm going to call her Dr. Rasha. She is the currently only Gaza physician who's training in Canada. We have 9 in total in our program. The other 8 are from West Bank. On October 12th, while she was in Canada studying in her subspecialty program, her brother was killed in Gaza. The day after her brother was killed, her family home was bombed and completely destroyed. With it, a number of her extended family members were killed. Her mother, one of her brothers, and her brother's children had to obviously leave and find shelter. They moved to another house in Khan Yunis. in the south, where they very soon received an evacuation order. They were told, you have to leave. So they have left multiple times. Each time they go, sometimes the place where they're trying to go to gets bombed and they have to change direction. Dr. Rasha has now lost 5 different family members. She's in Canada and realizes that her home is gone. The hospital, which she was planning to return to, has been bombed. And many of the family members she would go back to are either killed or are trying to leave Gaza as a result of their own safety. So I don't think she's going to go back to Gaza. I think the reality is that Dr. Rasha will probably stay in Canada and will be trying to find her work because it'll be impossible to get her back to Gaza, unfortunately. And it makes me wonder, do we need to reconsider the model of medical education? The challenge is always, do we bring people to Gaza to teach, or do we bring Gaza people to Canada to learn and then to return? And I think in Gaza, it's very difficult both ways. Because of the occupation and the siege, it's very difficult to get people in and out, whether it's international doctors going in or Gaza physicians coming out. It's a massive challenge. So I want to talk a little bit about the Great March of Return. I served as a medic at the War of Return in 2019. As you'll see here, there's people from all walks of life: men, women, children, people in wheelchairs, people walking, Christians, Muslims. It's basically a pan-Palestinian demonstration. And it was to protest or demonstrate for the right of return, which is a right enshrined in international law, in the Declaration of Human Rights, and in the Fourth Geneva Convention, but not a right that is enjoyed by people living in the Gaza Strip. So as a medic in the Great March of Return, I did consider myself fairly experienced. I had completed medical school. I did multiple rotations in intensive care. I did additional training in trauma. I had actually run a community ICU quite frequently as a resident and as a healthcare professional now as an internal medicine doctor. I had taken additional courses in trauma, so I was fairly well trained in as a medic. I'd also started a first aid team in Canada, so I thought I was pretty experienced. But a lot of the things that I saw working as a medic, I had absolutely no understanding or experience in doing. So just to give you an idea, when I started there, this is as I was preparing, and I'm not quite yet in my uniform, as you'll see. We still had to meet the team of medics. There was a team of 4. So once we got in our team of 4, you can see here, if you look in the distance, there's a mound of dirt. That mound of dirt in the central part on the opposite side of that fence is where the Israeli snipers would hover. The people who are on the Palestine side of that fence basically had flags and were walking. There were no guns on the Gaza side, so it was pretty clear where the gunshots were coming from. When I was working, the first person who was shot was a young man. He was shot on the right-hand side of the chest. Our team of 4 medics went out, picked him up. There was a pretty clean exit wound. He wasn't bleeding significantly, so we picked him up and carried him to the trauma stabilization point, which is a location where injured people can have a higher level of care. So for example, if he needed a chest tube, intravenous fluids, central lines, any of that can be done at the trauma stabilization point. So we brought this gentleman to the trauma stabilization point, and then we started to walk back to the demonstration. By the time we walked back to the demonstration, the sniper fire had increased in frequency, and there were intermittent bursts of machine gun fire. I was standing sort of at the back of this group, as the medics do. And typically when someone is shot, you wait until there's a break in the machine gun fire, you run out, you provide immediate first aid, and then you carry them to wherever they, whichever, either an ambulance or a trauma stabilization point, whichever is closest. By the time I came back with the gunfire increasing, I was at the back. There was about a 15-year-old boy who started running towards me because of the gunfire. He stopped probably about 40 yards from me. He tripped. And then he sort of bent over, and then he stood up, and that's when he was shot in the head about 40 yards from me. It was pretty obvious that he was dead. And by the time he had actually been shot, there were many other people who had been shot, including a medic from another one of the teams who had been caring for someone who was shot. So I instructed my team to go to the female medic who'd been shot. She'd been shot in the ankle, sort of in the lower part of the leg, but we had to apply a tourniquet. She was a fairly small woman, so I was able to carry her myself to the trauma stabilization point once the tourniquet was administered. I managed to carry her to the TSP, and then the rest of my team went to the 15-year-old boy who was later that day confirmed dead from a sniper gunshot to the head. That day, I saw a lot of other people shot. I saw a man who was in a wheelchair who was shot in the chest. I'm not sure if he died, but he was brought to this trauma stabilization point. There were children who were shot. There were healthcare providers who were shot. This was one of the most deadly days of the Great March of Return. You know, and when I got home from being a medic at this march, it was pretty obvious I'd witnessed war crimes. So I contacted Fatou Bensouda of the International Criminal Court and provided testimony. You know, it's interesting because the International Criminal Court ended up almost being preceded by the United Nations Independent Commission of Inquiry, which commented that, and I'll read it. It says, the commission has reasonable grounds to believe that during the Great March of Return, Israeli soldiers committed violations of international human rights and humanitarian law. They found that Israeli snipers targeted journalists, health workers, children, persons with disabilities, knowing that they were all recognizable as such. The conclusions of that inquiry didn't surprise me because I'd seen it with my own eyes. And even on previous visits, it was obvious that fishermen, farmers, people just simply working in proximity to Israeli military are shot for doing their jobs. So war crimes, unfortunately, have been well established to be happening well before October 7th. They're just now happening in the face of the, you know, an obvious view of the entire world. This is, you know, so I've seen war crimes with my own experience. We argue about whether the Baptist hospital was bombed by Israel or by Gaza. I think the argument is idiotic because there's been at least 24 hospitals that have been bombed by airplanes. Gaza does not have an air force. It's obvious who's doing that. We need to say Israel is bombing these hospitals. So this is Rantizi Hospital here. And this was bombed on the 4th floor. The 3rd floor is where the only pediatric oncology unit in all of Gaza is held. It was fundraised and operated by the PCRF. In fact, the doctor who runs the unit is one of the graduates of the Keys of Health program. It's the only place where children with cancer can get treatment in Gaza. And that has, unfortunately, that hospital is not currently operating due to lack of fuel and being bombed. Adult patients with cancer, all of the cancer care for adults was unified in the Turkish hospital in Gaza about 2 years ago. Unfortunately, that hospital is not functioning currently due to lack of fuel and is not operational. So currently, no patients with cancer are getting any treatment or have any access to treatment in Gaza. It's already been reported that in the 2 months when these hospitals have become non-operational, many of those patients simply have died due to their cancer not being treated. We talked about the 24 hospitals that have been bombed and not denied by Israel. This is a poster that you've already seen. Of 35 hospitals in Gaza, 22 are completely out of service due to either being bombed or being out of fuel and unable to operate. Of the 13 that are partially in service. They are operating at double their capacity, with essentially no access to medical supplies, medications. Subspecialty physicians are already in short supply and are even now in shorter supply, given that 283 healthcare workers have been killed since October 7th. This is an ambulance convoy, and this was a Red Cross convoy. And there's a little bit more to the story that hasn't been told. Everyone kind of knows that the Red Cross convoy was bombed in front of Shifa Hospital, and that there were at least 15 people killed and dozens injured. There's a little more to the story, though, that I think probably should be told. There were several ambulances filled with critically injured patients in an attempt to get to the Rafah border with Egypt to transfer these patients to an Egyptian facility where they might be able to get care. The ambulance convoy left Shifa Hospital and got about halfway to the Rafah border crossing when they got attacked and bombed. And even though no one in that bombing, the bombing hit the road, but there were 2 vans that were very badly damaged. And it was decided collectively that it would be unlikely that the convoy would be able to reach the Rafah border. So they turned around and they went to they went back to the Shifa Hospital. When they arrived at the entrance to the Shifa Hospital is when the convoy was bombed again. And many of the people within the ambulances, you can see here, there's many people who were killed in the vicinity of the ambulances. And for several hours, no one could actually get into the ambulance at Shifa Hospital because the entrance was where this bombing happened. In addition to this, more than 100 ambulances have been put out of service, either because they've been bombed or are non-functional for other reasons. Earlier today, Kamal Adwan Hospital, which was in the north and was partially functioning, they had thousands of internally displaced people in the hospital. 70 of the healthcare workers that were still there, committed, dedicated, still working, trying to provide care to the patients, even though they had essentially no supplies left. Those healthcare providers, 70 of the male healthcare suppliers were removed from the hospital, and their whereabouts are now unknown. This is in addition to the dozens of healthcare providers in other hospitals that have been arrested and whereabouts also unknown, including the head of Shifa Hospital. This is the Médecins Sans Frontières convoy. The driver of one of the vans was shot in the head, and while the passenger on that vehicle was trying to take over the driving, both of the vehicles were bombed. In total, there were 2 Médecins Sans Frontières workers who were killed. And in the process of trying to get out of the van, the remaining MSF workers were shot at on their way back into the Médecins Sans Frontières facility. Now, the Human Rights Office at the United Nations has already declared that they have serious concerns about international humanitarian rights violations by Israel. There's been immeasurable, this is their words, not mine, there's been immeasurable violations of special protection of civilians, children, healthcare personnel. A leaked document from the Israeli military has revealed that there are what are called high power targets of schools, mosques, universities, and basically physical locations that are targeted due to their significance. This, of course, is illegal by international humanitarian law. These are not military targets. These are civilian targets. And that would be a contravention of international humanitarian law. In addition to these targets of healthcare facilities, both of the med schools, the Al-Azhar University Medical School and the Islamic University of Gaza Med School, both of those have been bombed. And the president of the Islamic University of Gaza, who in fact did much of his education in the United States and in Canada, He was a physicist who had actually been nominated for a Nobel Prize. He was killed in the Jabalia refugee camp last week. So I've shown you all this. Where do we go from here? You know, after all this, it's hard to be hopeful, right? And there's been days when many of us have lost family members, friends. We've seen the horrific things that we've seen, the atrocities, and we wonder what do we have hope for? Well, I built this presentation yesterday. As it turns out, the United Nations General Assembly today did vote for a ceasefire, which of course includes immediate release of all the hostages, as well as a ceasefire. Unfortunately, that is not legally binding. So we'll have to see, given that Israel and the United States voted against it, we'll have to see what materializes. I'm hoping that something meaningful comes of it. I think that inevitably there needs to be an independent investigation for war crimes by all parties, okay? And then I think what you heard from Dr. Yasmine, I think is especially important. I ask myself, what is the role of a healthcare provider who is a witness, either in person or witnessing this from afar? You know, and I've witnessed some of this in person. I feel somewhat paralyzed witnessing some of this from afar. But as healthcare providers, we are witnesses. We do have credibility. The public does trust us. And with that comes a responsibility and an accountability that we have to speak up at times like this. I don't think there's any secret. I was suspended from my job earlier. I had death threats. My address was posted online. I was in hiding for a bit. And I made the calculated decision that I wasn't going to stop speaking up at a time when we need to be screaming. Dr. Hammam, one of the doctors I showed you earlier, he said to me something that I thought was very naive. He would contact me and he'd say, I need to do media today. Set me up with someone. Doesn't matter who it is, I need to speak. If the world knew what was happening, they would make it stop. If the world knew what was happening, they would make it stop. And so it is our job to make sure the world knows what's happening. Forums like the one tonight that have been organized, I think, are excellent and provide a safe space for us to discuss these issues. But a lot of the work needs to still be done. We don't have a ceasefire yet. We need to pressure our political officials. We need to speak up and educate those around us, okay? And a ceasefire isn't enough. There needs to be a massive, unprecedented amount of humanitarian aid to rebuild Gaza. There needs to be an independent investigation into war crimes. And even then, that's not enough. We heard of the history of Palestine. Our work isn't done until there is a free, peaceful existence for all Palestinians with justice and without occupation. That has to be the goal, the end goal for all of us. And I think about who should we really look up to in these moments, right? Even before October 7th, my hero has always been Muhammad Ali. I'm a pacifist as a physician. I think that's a reasonable position to have, but it may be odd to think that a professional boxer, one of the greatest boxers of all time, is my hero. But keep in mind, he was willing to go to prison not to fight in Vietnam. He was willing to give up his own freedom for something that was important enough to him. And I think at a moment like this, I think about it. I think, yes, I was suspended. Yeah, I had death threats. Yeah, that happened. The reality is my worst day in the last 2 months is better than the best day of anyone in Gaza, right? Like I'm fortunate to be here. I'm fortunate that suspension is the worst thing that can happen to me, right? So I endear all of you to, think about ways that you can have an impact in changing the public discourse, in communicating with politicians, making sure that a ceasefire happens, make sure that people from Palestine are humanized. And we've seen lots of other heroes. This is a wonderful story. I only have 2 slides left, but this is a wonderful story of a gentleman named Ghassan Al-Din. And he was a doctor who worked at the UN clinics. And of course, he had no fuel for his car. He used to get to all these different clinics by driving. And with the lack of fuel, he was unable to get to the clinics. Many of the clinics had been destroyed. So he started biking all around southern Gaza to different clinics. And he would, in fact, oftentimes with the clinics that were bombed for patients that couldn't get to the clinic, he'd bike to their home. He did this the entire time since October 7th. He's been doing this. Just determined to provide patient care. Dr. Hammam, why didn't Dr. Hammam go south after he was told by the Israelis, you have to go south? Why didn't he go? Well, he said why he didn't go. He said in his interview, who's going to take care of my patients? We're not animals. We're humans. We need to take care of each other. And so people like this, to me, in this moment, are heroes. And we need to use them examples to exemplify our own behavior and say, what can I do in this moment that's going to make a difference? Speaking up is a big part of that. I want to leave you with this. This is Dr. Wael Dadou. He is a reporter. He's actually one of the bureau chiefs for Al Jazeera and works in central Gaza. He's one of the well-known faces in Gaza for media. And while he was reporting, he learned that his wife, children, grandson, nephew, and niece were killed in an Israeli airstrike. Since that moment, he has continued reporting. He has continued saying the world needs to know the truth. He's done a beautiful series. If you have a chance to actually go on Twitter and look him up, he's done a beautiful, heartwarming series where he actually interviews children who've lost their parents. And he says, what would you want the world to know? And the children are speaking. So you have doctors who are speaking. You have reporters who are speaking. You have children with no parents who are speaking. It's imperative that we also are speaking. And we're speaking up for people in Gaza. Okay. Thanks very much.
Thank you so much, Dr. Thomson, and thank you to all of our speakers. We're going to have a very brief Q&A session based on the questions that you all asked throughout using the QR code.
So we just have 2 questions here. The first one will be directed towards Dr. Dawachi. If you want to come up and share your answer. The question again is, what are the primary health concerns for Palestinians living in Gaza, and how do they differ from those in other parts of Palestine when related to combat medicine?
So one of the biggest problems of the destruction in the hospital and limiting aid is that you're kind of creating an environment where kind of any injury is going to be very difficult to be treated. Adding to that, right now there is a famine. People don't have food. There's no clean water. Infections are on. So there is this kind of very condensed. As someone who's been through a lot of these humanitarian crises, he said that we're entering an uncharted territory. I think the idea that this is also a very enclosed place that people have nowhere to go is another kind of thing that we haven't seen in other kind of conflicts, where, my family is originally from the city of Mosul, and Mosul was, for 9 months, was bombed
under the US and allies, and around 12,000 people were killed, 138,000 homes destroyed. But there were also people there were able to escape to other places. There were 1 million displaced persons who were able to leave the city. In a place like Gaza, you're just moving from one place to the other in a very, very small piece of land. And this is why there are so many high, this is why you are seeing such high rates of casualties. Because basically people are escaping from the north, they're heading to their, like, you know, their brother-in-law house somewhere in the south. And when that place is bombed, an entire family is being killed. So you're not dealing with like really individual injuries, you're dealing with really huge collective injuries. A lot of these kids have no family members left to take care of them. When I spoke with Ghassan, he told me this really moving story. One of the like a 3-year-old kid, they didn't know his name. They operated on him. They put him out on a mattress in the ward, and the woman next door had her son also injured. So she started taking care of him. She was eventually became the person who would speak with the nurses, who would be responding to any questions about kind of if he was crying, if he was eating, and I think kind of that idea that in a place where all this kind of infrastructure of care collapses, people themselves become the lifelines for each other. And I think kind of this is something maybe we'll need to kind of discover again and again in a place like this. I don't know if that answers the question, but also I think the long-term effect of something like this is going to be really pretty troubling.
Thank you so much. We heard a little bit about this from Dr. Thomson and a little bit from Dr. Elfarra, but for the rest of the speakers, what gives you the courage to speak up in a culture of mass silencing of Palestinians' voice or those understanding of the Palestinian cause? So if Dr. Nagi would like to say something, or if Dr. Dawachi would like to.
Yeah. You know, I just paused because I don't really see a way for me to not do that. That's as simple as that. Like I don't. Sure, there's a lot of pressure, but you know, growing up Palestinian, seeing the very clear and cruel injustice that my people have faced since before I was born, since my father and grandfather and his father's generation. For me, it's the least I could do is to amplify those voices that are trying to be silenced. And, you know, to take it a step further, we see that these stories that Dr. Thomson so, you know, beautifully shared, these like human narratives that are hijacked by cruel, racist, Islamophobic representation and rhetoric that then ultimately puts our communities in danger. I mean, a Muslim American doctor in Texas was killed at the height of this language. A 6-year-old boy was killed. This is, I mean, we are not immune to this, you know, and it's really essential that our voices as people in healthcare, you know, are loud and contradicting these false narratives. So, you know, that's part of, for me, that's why I feel like it's so important to do that, especially in this context.
Thank you so much.
Sure. I mean, just I think it's just moral clarity. Just have to have moral clarity with what you want to do with your life. as a person, you have to, I mean, for me at least, it's choosing the right things to do, but also as a doctor, and I think kind of was mentioned here, and I mentioned it earlier around about the idea of witnessing, that we having that knowledge of the human body and have that knowledge of healing becomes something very important to kind of witness. And I think that's what we can do. We can tell stories.
Dr. Thomson?
I think one of the beautiful parts of Islam is that there's this concept that when we pass, the objects that are around us will pass judgment. So even if I die in a field and I'm alone, the trees, the grass, the rocks, those will bear witness. And there's different versions of this outside Islam as well, but it's the idea that when we ask ourselves what matters, it's not going to be most of the things we do day to day. It's going to be being able to say that when it mattered, we did what was the right thing to do. And there's very few opportunities in our life that we can actually demonstrate that are really significant. And I think this is one of those moments where there's a massive injustice. And for any conscientious person who is witnessing injustice, whether it's the injustice over the last 75 years of oppression or the more acute injustice of what the United Nations and Amnesty International have referred to as an ongoing genocide, regardless of which part you think is the injustice, it is imperative. If you don't speak up now, what kind of person are you? You know?
Thank you so much again to all of our speakers. In the sake of time, we're going to move to closing. Other questions that have been sent, we will gather information and send that in our email to everyone who has RSVP'd. So just a quick 5-minute closing, and thank you again to everyone who spoke and to everyone who's here today.
As we near the end of this event, we want to sincerely thank all of our incredible speakers who have shared their expertise and experiences with us here today. Hearing some of the harrowing accounts of the medical devastation in Gaza, especially from Dr. Nagi, from Dr. Ghassan and Dr. Thomson, must remind us all that these unspeakable atrocities, as Dr. Elfarra said, do not occur in a vacuum. Along the threads of health equity and health system science in our core curriculum at Robert Wood Johnson Medical School, we must understand that we cannot speak about health inequities faced by Palestinians without also speaking about the root cause of these inequities, the decades-long Israeli occupation of Palestine. As future healthcare leaders and advocates for human rights, these discussions have enriched our understanding of the plight of the Palestinian people and underscored our role in advocating for change and standing against injustice.
The Palestinian struggle for freedom and equality echoes global movements against oppression, reminding us of our shared humanity and the need for solidarity. The occupation has not only caused significant physical harm, but also has opened a deep wound in psychological and social fabric of the Palestinian society. This is a stark reminder of their constant struggle for basic human rights and dignity. Solidarity means showing our support for the Palestinian people. As you all might notice, many of us are wearing keffiyehs, and some of us have come up and asked what it means. The demonization of this cloth has incited hate crimes across the United States, most notably in Vermont, where just 2 weeks ago, 3 20-year-old Palestinian college students were shot at for speaking Arabic and wearing the keffiyeh. One now paralyzed from the waist down. This traditional scarf, with its meaningful patterns displayed on the screen, is an embodiment of the rich cultural heritage of the Palestinian people and a symbol of solidarity.
As we close this event, we must ask ourselves, why should we care about the Palestinian cause, especially as medical students? As we learn about health system science, we are watching the Israeli military bomb the last hospitals operating in Gaza, strike ambulances, and murder medical professionals. While we train to be patient-centered professionals, we are witnessing Israel maintain the longest blockade in modern history and dehumanize the Palestinian people in service of genocide. Although this is happening on the other side of the world, our institutions, both Robert Wood Johnson Medical School and Rutgers, enable Israel's occupation of Palestine and shield it from consequences as it acts in violation of international human law.
The Rutgers Endowment provides significant financial support for Israel's military and security apparatus. Our medical school is engaged in multiple economic and research partnerships with Tel Aviv University. Tel Aviv University funds and supports the Israeli Security Agency. Tel Aviv University provides academic cover for the Israeli occupation, including scholarly support for an Israeli war doctrine that justifies war crimes and asymmetric warfare, including the intentional destruction of civilian and medical infrastructure. Tel Aviv University refuses to release the detained corpses of 63 Palestinians from its medical school holdings. Our institution funds Israel's military-industrial complex and normalizes all parties directly involved. We make the following demands of our administration. 1. Renounce support for the Memorandum of Understanding establishing Tel Aviv University as a tenant of the Helix NJ Health and Life Science Exchange, the new home of Robert Wood Johnson Medical School. 2. Publicize and end all financial and research partnerships between Robert Wood Johnson Medical School and Tel Aviv University, including any receipt of NJEDA grant funding allocated for Rutgers Israel collaborations. 3. Call on the Rutgers Board of Governors to divest from the military-industrial complex supporting Israel's genocide in Gaza, including Motorola and General Electric. 4. Protect the right to free speech and public assembly for students at Robert Wood Johnson Medical School who speak on Palestine and organize for material divestment from Israel. Please use the QR code to sign our demands letter, which includes sources and background, and be involved in our future actions to exercise our responsibility as future leaders in healthcare. Thank you all.